will have a tremendous impact on prices. A certain gentleman who's in the room who will say a couple of words actually said this is more important than health care. And when he said that, my ears really perked up, and I listened, and they were right, and they gave me plenty of examples. And that person recently got the Presidential Medal of Freedom. His name is Art Laffer, and he's a very talented guy. Where's Art? Is he here? Yes?
I'm sort of short.
Oh, I didn't see you back there. Right? Stand up here. Great gentleman, and you brought a man here who's the king of that world. And hello, how are you? That's the guy. And you made that statement to me, more important than healthcare. That was a big statement. As soon as I heard that, I said, that sounds good to me. It's transparency. So I signed, as you know, an executive order, historic. And we're requiring price transparency in healthcare, forcing companies to compete for your business. It's a very important thing that we've done here. I don't think it'll be covered by you, but it will be in the years to come. Our goal was to give patients the knowledge they need about the real price of healthcare services. They'll be able to check them, compare them, go to different locations, so they can shop for the highest quality care at the lowest cost. And this is about high quality care. You're also looking at that. You're looking at comparisons between talents, which is very important. And then you're also looking at cost. And in some cases, you get the best doctor for the lowest cost. That's a good thing. Today, I'm proud to announce 2 new actions implementing that order. First, we are finalizing the rule that will compel hospitals to publish prices publicly online for everyone to see and to compare. So you're able to go online and compare all of the hospitals and the doctors and the prices, and I assume get resumes on doctors and see who you like. And the good doctors, like I assume these 2 guys are fantastic doctors, otherwise you wouldn't be here. And the bad doctors, I guess they have to go and hide someplace. I don't know. Maybe they don't do so well. I don't know. But if they're not good, we are more interested in the good ones. It's called rewarding talent. Second, we're putting forward a proposed rule to require health insurance providers to disclose their pricing information to consumers. We're giving American families control of their healthcare decisions, and the freedom to choose that care is right before them on the internet and elsewhere, but on the internet. Very, very open, very transparent. That's why it's called transparency. And this has been done on small bases on individual hospitals. In fact, Art, you were telling me about that with your hospital, that you're on a board of a hospital that did this. I'd like you, actually, before I go further, I'd like you to talk about that just for a second. Art Laffer. Art, just mention that if you could.
Yeah, you kind of lowered really far. Sorry about that. Let me, if I can, just say I wasn't the chairman of the board of Centennial Hospital. We had some problems, but when you look at this, this is the biggest revolution I've seen in generations. I mean, and as opposed to most revolutions, this revolution saves lives. It doesn't cost lives. And in this revolution, it saves money. You don't have to spend money. And what you've seen here before is that we have no transparency whatsoever in medical. It's like the hermit kingdom of industries. You don't know what the price is, you don't know what the outcome is, and you don't know what the inputs are. What this does is this pulls away the veil and allows people to see exactly what they can and what they do. And if I can say, I think this will lead to a phenomenal change in the U.S. outcome of employment, output, production. It's just the one of the industries that desperately needs this. I'll stop about here, but the last one I can remember being involved with was with Lady Thatcher when she privatized coal, steel, and the railroads. I mean, the changes there with Sir Keith Joseph. This outdoes all of those revolutions, sir. It's the most amazing of all time, and it takes real leadership to do it and real practitioners to be able to get it through. And Secretary Azar is a great practitioner, and my buddy Larry Van Horn is also a great practitioner, as well as Larry Cutler, by the way. Thank you, sir.
And I'd like to have Larry maybe say a few words and explain what this is that would be.
Sure, Mr. President. Well, this is a momentous day. Americans year over year have been faced with higher and higher healthcare costs, facing a higher and higher obligation to pay for those out of their own wallets without information around the price and the quality associated with that. The charges that have been put out are fictitious. Nobody pays the charges. This effort is to make real prices transparent. The net allowed amounts that drive the decision making for patients every day will now be in their hands. They can make better trade-offs and have hopefully more money in their wallets and their paychecks to pay for all other goods and services they need to live their lives. So this is a very momentous day, and I appreciate the efforts of the administration all the way through in terms of being able to follow through and execute this.
And we did it max, right? We didn't do a smaller.
We did it
version.
max.
This was-
It's A+.
I kept saying. There are versions of this. I said, no, I don't want the C or the D. I want the A+. And we did it the A+. So I'm very happy with that. And